Hello, Assalamu alaikum. Kiran, welcome. So nice to see you after years that we were together in RMC. How are you?
I'm good, Farhan, and it's very good to see you as well.
Thank
How are
you.
you?
Thank you. I know through you we can actually extend our gratitude and our love to our class fellow Ifti, who is our dear friend too. And I hope you and your family is doing good. Thank you for taking the initiative to join me for this friendly discussion. And I've recently found out about you that you are a radiologist. So that's very nice. My eyes are not never that good enough to detect subtle changes in. Uh, so tell us a little bit about you. What do you do right now?
Well, I'm professor of radiology at a private medical college, Foundation University Medical College, which is affiliated with the Fauji Foundation Hospital. I think we have heard of the
Y-
name of the
y-
hospital. It's quite the old hospital,
So
I believe.
excuse me for one
So
second,
I'm
right
professor of
there.
radiology and head of radiology department.
You are
Yeah.
professor of radiology? You must be the youngest professor ever. Maybe we could register you for. When did you become a professor?
Well, I think I was a bit late. I mean, I was supposed to be a professor 2 years back, but I went to UK for some time, and that period of my work it wasn't counted. So I was made professor last year in June.
Congratulations.
Yeah, last year.
We are
Thank you.
I'm so proud of you, and knowing that you are now the head of radiology department at Fauji Foundation Hospital and Fauji Foundation Medical School. I can recall that I could have actually come and meet you, because when I visit Pakistan, my parents' house is very close to Fauji Foundation Hospital. So next time, if you get a surprise visitor, uh, you would probably
I would
see
love
me.
to host you, and I also live close by, so you can come to my house and meet if you too.
Yes, that would be very nice. So, Kiran, let's go back to our life in Rawalpindi Medical School. And right after the graduation, where was your life taking you? Could you take us back to that journey?
Okay. So after the graduation, I did my house job. First house job I did in medicine with Dr. Shoaib Shafi.
Okay.
And for the second house job, I think at that time, we were told that, the girls, they have to do gynae, although I wasn't interested in gynae ever. But then because the girls were supposed to do gynae, so that's why I thought, okay, fine, let's do gynae. So we wanted to do it in the best unit, and at that time Dr. Rizwana Chaudhry's unit was number one. So I applied, me and my friend, but we came to know that and six of the girls, they were already continuing their house. There was only one. So I didn't want to do that. Then I did surgery. I did surgery with Dr. Musaddiq Khan at Holy Family, 6 month surgery. And
Okay.
then came radiology. So you must be wondering why radiology?
Yeah. I
Because at
I
that time, I think, Farhan, when we were not exposed to radiology at all. Do you have any memories of being taught radiology at final year level? Well, I
I
have some, and I want to, I want to share.
okay.
Remember, there was an old gentleman. I mean, I don't remember. I'm sorry, I don't recall his name. He was head of radiology with a beard, white beard. Used to wear shalwar kameez, and he took some of our lectures. And I know we were supposed to go to the wards, and we being girls were, we went to all the wards almost. So we went there, and I still remember he said, "लड़कियों, तुम लोग यहाँ मत आओ, ये बहुत खतरनाक शुआएं हैं, तुम्हारे बच्चे नहीं हो सके." I mean,
Oh my
the first
God,
time we
look
went
at
there.
that. Look
So
at that.
that was what I recall. And when I was doing house job, I saw when we used to take calls for ultrasound, they were like guys sitting in, dimly lit rooms, and they were doing ultrasound. So it felt horrible at
Yeah,
that time.
yeah, yeah.
Yeah.
Not
So
very
that,
attractive for a lively person um,
no.
like you, of course. So then, okay, then what happened? So how did you
Then what
then?
happened? I tell you what happened. What happened was that I wanted to choose a specialty in which I can, carry with my work and family both. So medicine, surgery was too hard for me, and I
Yeah,
didn't really like it.
Yeah.
गायनी पहले बता दिया, उनसे भाग गई थी. Medicine was too much saturated, so I thought, okay, fine, what things are left? So at that time we thought radiology and pathology, they were like uh, uh, ठंडी fields
Yeah.
लगती थी, right?
Hmm. Hmm.
And we no guidance, nothing. I mean, nobody was there to tell us anything. So I said, okay, in pathology you are looking at slides all the day and you don't have patient interaction. And me being a very talkative and like
Interactive person.
extrovert person, yeah, I wanted to be with patients. So I said, okay, fine, radiology कर लेते हैं, देख लेते हैं क्या होता है. So I just went to radiology. I gave my part one. पहली दफा मैं fail हो गई थी first time. So I then appeared again and I cleared it, and
Well,
that's how I came to radiology.
I have to tell you that you have an incredible CV. I would like to know that how do you find time to remain so active in your professional growth? I think that I have probably done one fourth of what you have done in your life. You have been to conferences, meetings, you have traveled a lot for your work. I was going through your conferences, like many countries in Europe, you have gone for your educational purposes. And it's been, I think it was really your calling. And you just, when you got into this field, you just fell in love,
Yeah,
right?
I did. Yeah, you
So
put it
I,
right.
I'm looking at you. You became a radiologist essentially at Military Hospital, MH, Rawalpindi, right?
Yes.
So you started doing your basic work as an like a resident, ultrasound, MRI, Dopplers, and everything. So was it a difficult time? Was it hard for you to learn? Because it's nothing we learned as medicine students. So how did you cope with that pressure?
Yeah, because when I entered radiology, I came to know that although it is not hard physically, but mentally it was too much. Because being a radiologist, and in Pakistan mostly we are general radiologists. We don't do specializations like in America. When I went to UK, I said they were like MSK specialists, and then they were like the cardiothoracic and neuro and everything. But here you are a general radiologist, so I have to know ENT as well as eye as well as bones. I mean, we haven't studied too much of all these things. So I came to know that although there's a lot of brain, involved, because you have to study a lot. So in the beginning, it was a bit hard, but then I got used to it, and I really loved it. I'm a detective story fans right from the beginning. So I think it's like solving a murder mystery or a mystery. You have got all the clues from the clinical and the lab and everything, and you join all that together to come to a diagnosis. And in the beginning it was difficult because I got married. I started my residency in 2002 and I got married in 2003, and then I had Bilal uh, in 2003 December. So
Yeah.
with the baby it was quite difficult. It was.
Well,
But
you've done a remarkable job. I have to tell you that it is. If anybody would look at the academic achievements and courses you have done, so right now, as being the head of the department, what are the facilities, diagnostic facilities you offer to your patients?
we have the general radiography, that is the x-rays. Then we have got fluoroscopy. Then we've got ultrasounds, Doppler ultrasounds. We do ultrasound guided intervention procedures. Then we have a CT scan and an MRI scan, and a mammogram is soon about to be launched. We don't have a mammogram till now, but it is just in the process.
I would also think you have bone density scan, DEXA scan.
But we don't, the rehab people, they have it. Yeah, we
Okay.
don't have.
So that's surprising because in our hospitals, radiologists are the ones who review DEXA scans.
No, we don't do it.
Okay. I'm sure that that's how it's worked up there. Now, let me ask you, I was looking at it. You had initially thought of doing some foreign education in England, and you did PLAB, and I guess you didn't want to live there, but you went for your degree in England. Tell us a
Yeah.
little bit about that. So your experience in radiology took you to England for education.
Well, Farhan, what happened was I did my fellowship from Pakistan in 2007. Alhamdulillah, my journey was very straight. That when I entered ended my residency, I gave my exam and I cleared it. So from 2007 to 2014, after about 7 years, I was a bit, it was getting stagnant for me. I wanted to do something else.
Yeah.
So here, some fellowships are being offered, post fellowships. Shifa International offers intervention radiology and a body imaging, two fellowships. But considering the fact that I had to manage my home and my kids and everything, it was very difficult for me to go to Shifa every day, and the timings there were very long.
Yeah.
So I discussed it with Ifti. I said, I want to do something. He said, you just do something which you can do from home. Just give some exams. So when I checked the Royal College of Radiologists, the UK one, FRCR, it is called the degree, they're okay with our residency. So if we are
Distance. Okay.
yes, so they allow us to take their exams. But that is a very long process. They're like 8 modules. The first module's got physics and anatomy. So मैथ से भाग के मेडिसिन में आई थी एंड रेडियोलॉजी में आके फिजिक्स बहुत पढ़नी पड़ी, too much
Wow.
physics.
Yeah, it's a lot.
But anyways, वो हो गया. So I just did okay fine. तो उसका ये था कि I used to study at home and you just have to give the exam. But to take the exam, you have to go to UK or Singapore. There are like some centers. In Pakistan, they don't offer an FRCR. So I went there. I did the first part. Then the second part is got 6 modules. The whole body is divided into 6: CNS, MSK, GUT, and everything. So while I was doing those modules, I came to know that for the Viva part, it takes a lot of time for the non-UK residents. People were waiting to take the Viva for like 2 years. So somebody told me, okay, why don't you give PLAB and get GMC registration? I said, okay, fine. पढ़ाई तो कर ही रही थी, कर लेती हूँ. So PLAB 1 was very easy. Although I did PLAB in 2015, how
Yeah.
many years after graduation? We graduated in 2000.
Yeah. So that's 16 years. Yeah, 16
Yeah.
years
So
later.
I didn't know the basic medicine. I was a radiologist for quite some time. So the part 1 was easy because there were like 1700 MCQs and they were all the net. And being a radiologist, it was a bit easy for me because I knew something about all the specialities. But for the part 2 thing, I had to go to UK. So I took a workshop there. There's a guy named Swami. There's a 14-day workshop, and there I learned again the suturing and the IV cannulation, the bleeding, the PR, PV, everything, because that was all practical, and that was a final year level. So that was a bit difficult, but alhamdulillah, I passed. And when I passed, when I got registered, I started getting offers from there because they are short of doctors.
Yeah.
So the first place that I went for interview at that's Shrewsbury. It's near Wales. It's a very beautiful town, and that was the first place where I went for interview, and they offered me a consultant post. They said, okay, fine, come here as a consultant radiologist.
Wow.
So I was, oh my God.
Yeah, that's amazing. You must be that's a beautiful place. I looked it up. And so you worked there now for how long?
I worked there for 8 months.
Oh,
And
without your family, you were just by yourself?
it was hard, but in a way,
It was a good break, right? Yeah, my wife keeps
myself.
telling me that. Yeah. She's
I
like,
got to know myself, who I was,
yeah.
And I traveled a lot. And because there I was traveling all the time, because at the weekends I used to go to my friends or my cousins. So I traveled a lot, I learned a lot. And although it was a tough time, but then I enjoyed the professional part a lot.
I have to say that you just said a remarkable comment, which is you learn a lot when you're alone. In Pakistan, thankfully, we all come from privileged families and we never have to worry about our food, our home. But when you're by yourself, although you have everything, there's a certain amount of uncertainty, and that makes us a little bit more stronger. I'm glad that you were able to do that on your own, and I think we should encourage more women to take that chance of exploring their talents. My question to you is that you are now an MCPS, an FCPS, and also a fellow radiologist from Royal College of Radiologists London.
I haven't completed the degree. I'm still doing
You're
it
you're
because of.
working in that process. So once that is completed, that would be huge accomplishments, because you have not only Pakistan's but also foreign. And now, where is your current journey taking you of life? Are you happy with Fauji Foundation right now?
I am happy. Yes, I am
Okay.
happy because as I said to you before, I'm like balancing my family, my work. So Fauji Foundation is just 7 to 10 minutes drive from my home,
Yeah.
right? And although being a head of the department is a bit taxing, I mean, I'm very happy with all the academic work. You can give me anything, I'll just do. I'll report the scans, I'll go teach. And I love teaching, by the way. We also, because I'm teaching the students, so I just love it. But the administrative part is really tough. So being
Well,
head of, like, sorry, yes.
I have to tell you that I'm glad that you are bringing this up, because the administration is also a leadership role.
Mhm.
Women are naturally they're better leaders. And one example is all the countries where women are the leaders, they don't have as bad of a coronavirus as the United States, where of course we have the best president in the world. But what I'm trying to say is that leadership comes naturally to women, but having the opportunity to lead a department is taxing, is stressful. But I think if anybody is capable of doing it, it would that be you, because you know how to manage people like kids, right?
You have to do multitasking. Women do multitasking.
Multitasking, yeah. So all of those things, if you apply that time with peace of mind, of course, you have a supportive husband, and thankfully, so your family is well. I think it's a great opportunity, and it would encourage so many other women, because once there is another woman up there, they would see that you were there. It would boost the confidence. So I'm very happy that you are at a leadership role. And I think if you just look inside you, things will come naturally, what decisions you should make. And I think that's what I want to tell us a little bit of a moment, something that you remember, maybe a moment where you were surprised that you saw a patient and it changed your life. Anything memorable from your life?
Yeah, I won't say it changed my life, but one thing, Farhan, as I was telling you about where I worked in, I'm working in Pakistan since 2002. Then I went to UK for some time, and when I went there, I realized that we lack empathy and sympathy. We Pakistanis, I'm sorry, in our medical school, nobody told us, to be sympathetic or empathetic to a patient. If
Mm,
you remember,
yeah,
we were
yeah.
when we were
I mean,
surgery. What is that?
these
The
words
patient,
never come to our discussions. No.
yeah, the patient was never a person. You
Yeah.
never call the patient by his name or something. You don't talk to him. So when I went there, I suddenly I was in a strange place. I mean, I was talking to patients. I was taking permission. Okay, sir, can you turn to your left while I was doing ultrasounds? Can you turn on your left side? And now I'm going to do this and that. And at the end, I used to tell them. So when I came back, one thing changed in me. When I came back, I said कि ये तो मेरे अपने लोग हैं पाकिस्तानी तो
Yeah.
अगर ये जाहिर because the kind of patients coming to us, they're like the families of Sapahis, soldiers, so
Yeah.
they're not educated,
Yeah.
so I think they're, and the best thing, they gave us duaएं. You don't get duaएं there, nobody gives you a dua, but here Farhan, you feel so good कि जब आप
Yeah.
खत्म करते हो और आप उसे बताते हो कि अम्मा जी ओके ये मसला था, ये है, ये होगा, अच्छा बेटा अल्लाह खुश रखे, something like that, जरूर दुआ
Yeah.
मिलती है. That is
Thank
this
you.
part.
Yeah.
When I came back, so now I'm being more empathetic, sympathetic, and try to explain to them at their level, because the patient was lying in front of you. He's very apprehensive. उसको नहीं पता कि उसके साथ क्या होगा. तो just नहीं बीबी जाएं. People used to do अच्छा जी रिपोर्ट ले जाएं. ये रिपोर्ट में क्या है? 2 मिनट लगा के अगर उन्हें बता देंगे तो क्या जाएगा?
Wow, that's extraordinary. What you shared with me, I think it's just I'm feeling a deep respect, because we learned this in Western worlds. We came to realize that a cleaner in your hospital deserves the same respect. And I was ashamed of myself thinking otherwise. Um, but later on, I realized that no, everybody deserves respect, and our patients respected. So thank you for bringing that up. I think it's a great point, the empathy, respect, and giving them what they deserve. And I agree also, the well wishes are something that help us in ways we don't understand. So thank you. My question is, where do you see yourself now in 5 years? What are the things you want to do now going forward, 5 or 10 years within this hospital?
Well, in this hospital, I think I have achieved the highest, most level. But I would like to be, I'm like supervising trainees, FCPS and MCPS. I've got 11 trainees at the moment. And now what I want to do, I want to invest in them. I want to
Yeah,
teach them, although I'm doing it, but I don't have much time because of all the administration stuff. But what happens is we are not supposed to take their exams or anything, but I have made a schedule. I work really hard so that kalko when they go someplace they say okay fine Dr. Kiran ke trainees hain, you know
very nice. Yeah.
they,
So that's how
that,
your legacy lives on.
yeah, that's what I want to do.
11 trainees is huge. How big of your department is? How many radiologists are there?
We're like 8 consultants and
It's a pretty
right
big
yeah,
hospital, big
yeah,
department.
it's a big
I have
department.
to tell you that I know that a hospital because I did my surgery fellow house job there. It's a good hospital. My question for you is: are there any roadblocks that you find as a female physician, a leader physician, and what could you share some of those with us?
Yeah. I can talk for hours because in the beginning when I was doing my residency, I don't think there were any roadblocks, just problems with the kids and stuff, the thing that, and for that I'm really thankful to my husband Ifti, because if he wasn't there, if he wasn't supportive, I wouldn't have done anything. Like I told you, when I went to UK for 8 months, he was here, he was looking after the kids, right?
Yeah,
So,
yeah,
it's a very big thanks to him and to my parents, definitely. So recently when I was promoted head of the department, suddenly you know things weren't that good because the men, they weren't able to come up with the idea of being a woman, number two a young looking woman.
yeah.
आप तो बहुत छोटी लगती हैं, आप तो बहुत छोटी हैं. I said no, I'm not that young, I look young. So बाल भी इत्तेफाक से कोई सफेद नहीं हुआ अभी तक, और ऐनक भी नहीं है. So anyways, so at MDTs and at the surgical meetings, and sometimes it looked to me as if they're like putting me down, and they were like trying to blame me. So that was a really that was a roadblock. So I went to the chief administrator, the commandant. We have got a retired general over here because it's an army thing. So I went to him and I said, "Sir, what can I do? I mean, one thing, I'm very polite. I'm not a abusive or a battamiz person. I can't do battamizi with these people." And they were like so seniors to me. He said, "No, Dr. Kiran, you be just the way you are." But then at some point I thought, no, at times you have to be assertive, you have to say. And then the best thing is now everything is evidence based, so whenever they throw something in my court, I reply to them with the evidence. So this is what is happening, so that's why we are going with that. But in Pakistan, I don't know about you tell me about what's this like in America, because in Pakistan it's difficult to see a woman leading a department. Not about gynae, they are fine with the gynecologists, but in other departments, especially like in radiology, it's hard for them. But I think times will change in another 10 or 10 to 15 years maybe.
I have to tell you that it is a common scenario that happens in certain fields in America. Because there are some expected places in America where women are leaders. Um, as you can see, America does not have a woman president.
Mhm.
And that tells you that there are certain fields that even Western world does not easily accept women leadership. And I think it is time for globally people to understand the talent, the multifaceted brains that women can bring in the aspects. To keep to answer your question, in medicine it is not as big of a problem, but if I look at my hospital, out of 5 departments or 6 major departments, there's only one head of the female. So it's, you're not alone, but you have to stay persistent and you have to prove by knowledge and by assertiveness. So what you're doing, I agree with you 100%. I'll give you a personal example. My wife chose a profession which is very unusual for a Asian Pakistani Muslim woman to do. She is a she's in fitness industry.
Okay.
So she is a personal trainer. She has 11 courses. She's masters in exercise physiology. She's a master instructor for many other aspects of training, like spinning being an example. So when she goes and teaches them, she gets the same kind of a response you get it. And it is very discouraging, disappointing. When she comes home, she tells me that it is very hard for some men to accept a woman in an authority position. But I think with time, men have to understand that this is, this is not a right attitude. Keep doing what you're doing. I've gone through your CV and I've realized that you are passionate about improving your knowledge, but you're also passionate about communication. You have learned quite a deal about how communication happens. Biggest problems in the world are communication. So tell us a little bit about that.
Well, I am a very talkative person, and I really love to communicate. But then what I have learned is that for a communication, you have to be a good listener.
Very nice.
First, you have to be a good listener, and then you can, when the communication will go two-way. Uh, that's what I.
You have also been looking into some sort of motivational workshops for medical students, I believe, and how and when to ask questions. Um, how do you, when you are teaching students, how do you teach them empathy and importance of listening?
Yeah, that's the first thing I think I tell the patient, my students. When we were in med school, the things were different. Like in anatomy, if we were doing the heart, in physiology, we'll be doing the nervous system. But now there's a modular system. So from first year, we are involved with the students, right? At the first year, because it's a modular system. For example, if they are doing a CVS module, so or a respiratory module, so we being radiologists, we tell them the normal anatomy on imaging, like on X-ray, on CT and stuff, so that from right from the beginning they have some knowledge about it. So that's why I come in contact with the first year students, and I try to take the first class, their, one of the beginning lectures. And that's why what I always tell them, that you have to think of the patient as if one of your mother or father or brother is lying there. You have to be empathetic, and I have been conducting workshops for that. I did a medical ethics certificate course from SIUT. There's a hospital, I think, if you're well versed with, it's a Sindh Institute of Urology and Transplant in Karachi, and there's a department of bioethics, CBEC it's called. So they usually do a diploma of 1 year, and there are multiple modules. So I took one module in 2014, and that helped me a lot. That really helped me a lot to see what is empathy, sympathy. So we conduct this at the first year level, and then we conduct another one when the kids, they are in the final year. But Farhan, the most important thing is they learn by seeing what they are seeing and their seniors. So if we, the seniors, the consultants, or the registrars, if they are empathetic, so the students, it's a passive learning. आप उनको कितना भी वर्कशॉप्स करा दें, आप सब कुछ करा दें, बट अगर वो जाते हैं वार्ड में, the doctor is not behaving with the patient, so वो कैसे करेंगे?
Yeah,
So
that's what.
ये,
Now, let me ask you about, is there around where you work, you just mentioned that veterans or ex-army soldiers' wives and families come in. What is the population that you feel is deserves more help from your eyes? People that we need to think about them more in terms of helping that population of the society.
I think that the patients that I cater for, all these the families and the parents of these supplies and the soldiers, because they don't know much, they have limited knowledge, and then they're coming from far-flung areas. They try to come. They come at 7 o'clock in the morning, and the hospital closes at 2:30. So they want to leave. They want to be shown to the doctor. done with the investigations, given their medicine, and they go back. So it's very, at times, as I've told you, that I try to be polite, I try to be empathetic, but at times it gets very difficult. When this patient comes to you and he has a CT scan, he said, "Ji, mujhe abhi report chahiye." So it gets very difficult to, try to communicate to them, कि जी, it's a very lengthy process, हमें एक एक चीज देखनी होती है. So this is the population to which we should, educate them.
So that comes to the point, and thank you for your willingness to help us develop some medical literacy. And medical ethics is another part that you could help us develop the information, and also putting the expectations people should have from doctors too. Right? Sometimes their expectations are out of place because they don't know the system, and educating about how it works would help us. My question for you is, right now, within your field of radiology, what is your favorite modality that you actually enjoy the most right now after doing everything? What is your favorite modality?
I think my favorite modality is still ultrasound, because while doing ultrasound, I'm in contact with the patient.
Yeah.
Although it doesn't tell you everything, you have to go through some higher modality after that, and it's fun looking at CTs and MRs and everything on the computer. But that's a very nice question, Farhan. I really like your question. I've never thought about it, but
Yeah, I
that's
think that
something.
I can tell you that you've brought back that many times, and I wanted to get to this point of a personal touch, because most radiologists are sort of people who don't like interaction with people. You might be an exception, and I can see in you that, because you're the radiologist who actually wants to talk to people. In America, there is a joke that when you don't like people, you become a radiologist.
Yeah.
But for you, I could tell that you are actually a more involved person, likes human interaction, and ultrasound. I can agree with you. What I want to ask you, go a little bit deeper into your what do you do with ultrasound, and what body parts are you comfortable with? I can
Uh,
understand breast, but musculoskeletal, you have worked with rheumatology and Fauji Foundation. Tell us what things you are most comfortable in ultrasound.
I'm in abdomen, pelvis, most comfortable. Breast, very comfortable. Musculoskeletal, not that comfortable because I don't do that much. But then the rheumatology department here, we've got a very good communication system with them, and we usually do the ultrasounds together. So that's
Oh,
how we've done,
I
because the
can then
rheumatology.
I can join you guys and learn and share my experiences too.
Please do, whenever you come next, we'll hold a workshop or something, and you can come and you can teach.
Wonderful. Yeah. I
But
I have to I have to tell you that radiology itself, you would never think of it as a place where you can access in the fields. I've recently come across a company that is out of Canada. It's an emergency medicine physician who actually has an ultrasound machine on his iPad, and
oh,
there's
yeah,
a
I saw that.
Butterfly. The company name is Butterfly. The probe that is used,
Yeah,
and
with your
I
phone, it looks with your
and
phone.
you can go and do, he was doing pleural effusions in Africa, he was doing cytic evaluations, and I reached out to him. I said, it's really exciting, what technology are you using? So he showed me, and I think maybe that is something that we can try sometime in the real world through your help, to reach out to people in the community and see if we could do a little bit of trial of that.
I've got something going on in my mind, that I wanted to buy a
Sure.
portable machine and go and do these some charity work. I really, because now I really want to do some charity work. So I've been looking over. There's a hospice, St. Joseph Hospice, somewhere in Westridge, and I'm like, I'm in fact, after Ramzan, I'll get in contact with them, because they want to have ultrasounds, and they had a machine, but it's somewhat, I think it's very
I would
old
tell
and.
you, I'm glad we both have a similar interest in that aspect. I would share with you the information I have, and I think you will save a lot more money if you, rather than buying a big machine. Even portable is 25 to 35,000. This is only $2,000 investment, and if you do community work, and you tell them this is how you're going to use them, they might give it at a much lower cost. So I will reach out to the company. With your collaboration, we can work on something like that.
There's another thing which there's a field in which I'm doing a lot of work, that is eye retinoblastoma. Basically, that was
Yeah,
I
so
would
tell us a little bit about
ultrasound.
that, because
That's
that's also
that's
ultrasound based, right?
yeah, that's after a sound. Although it's basically the diagnosis of retinoblastoma. If the people are not so well versed with retinoblastoma, we've read it in our medicine. It's a tumor of the eyeball, and it usually presents in small kids from I think up to 0 to 2 years, the most vulnerable age. And because if you remember, Farhan, there's a eye hospital across from Fauji Foundation, Al Shifa Eye Hospital.
Yeah, yeah. I
A
think
lot of
Yasir works there. Yeah.
Okay, so a lot of patients, because there's the pediatric ophthalmology, the head of department. She's my friend. In fact, we met somewhere, and she said, okay, Kiran, we do a lot of CT scans for these patients, and because that was a Falahi idara, there was a charitable trust. So she said we don't get reports. I said, okay, fine, send me the CT scan. So I still remember, and I tell this story to everybody because it's very close to my heart, that there was a man, he came with me with a very pretty girl from KP, from the northern
Not, yeah.
northwestern area. Most of the patients are from KPK, by the way. I don't know why.
Oh wow.
So she was,
Maybe
yeah,
they
she
don't
was
have it.
4-year-old cute girl with I still remember hazel eyes, and he brought the child and showed me the films. And Farhan, when I saw the CT scan, it was so horrible because it wasn't done on orbital protocol. It was just a simple CT and 1 or 2 cuts of the orbit. So I really wanted to help that poor man. So I said, what to do? Okay, fine. Let's put the probe. Let's put the probe of ultrasound on her eye and let's see what happens. And I think Allah Mia has provided us two of everything so that we can compare. Being a radiologist, I can say.
Yeah.
So when I saw the eyeball, I did a little bit of eye, but we didn't used to do much of ultrasound of eye. So there was a mass and there was a calcification, and I reported that ultrasound. And from that day onwards, all the patients coming to Shifa for their CTs, they used to come to me. अगर अभी आप किसी को पूछो, everybody there knows my name because don't used to charge. मैं charity पे करती थी. And now with our MRI, when we had our MRI, because these patients, they need an MRI at the end of the day. So that's a forte of mine. I can say that's a niche for me, that I do a lot of RB and on ultrasound. So if this portable things comes, I think what we can do is we can go to those places and we can screen the kids there.
Um, this is phenomenal. What you have brought is actually not only something you're doing for people who need help, but also look at this. You have brought in new knowledge to medicine. I don't think I've ever heard of ocular ultrasound, be honest with you, because maybe I don't have patients exposure, but it is something really new, novel, which can actually help. So I have to say that it is an extraordinary, a phenomenal way of looking at things, that if we start thinking out of the box, things come naturally. It's willingness to help somebody is what counts. And I see you have presented that ultrasound findings in various of your meetings
Yeah,
and publications.
that's what I went to Vienna twice and I presented over
It
there.
is, and I'm sure that people acknowledge that, because it is something that we have not heard and came across. And
That's not
sometimes,
happening. Mhm.
because in wealthiest countries in Western world, they have MRIs, they have CAT scans, but in countries like ours, we need thinking like that, that could save money and deliver good results. So so this is would be a huge contribution from you to the rest of the medicine. I have to conclude our professional session with this word of appreciation for you. It's astounding work that you did, and I think we can continue to cherish this and work on this as we go along. So thank you very much. Hang in there for a few minutes, okay?
Okay, fine. Thank you. Thank you.